One thing that we are not talking about quite as much right now is healthcare. And we want to really bring that up front and center because, as you know, it's 17%, approaching 18% of U.S. GDP. It's a huge chunk of the U.S. economy. It affects every single American across the country. You, of course, are a physician yourself, a gastroenterologist, I believe. And you have put forward a proposal with some other people in the Senate to try to address at least part of that. Explain to us this surprise medical bill proposal.
So, David, first let me say, we speak about tariffs on TV, families speak about health care around their kitchen table. This is the issue which is important to them. Surprise medical billing is when you go to an in-network facility and you get an out-of-network bill, sometimes for thousands of dollars. And the provider and the insurer use the patient as the point of leverage to negotiate their differences. That is wrong. So what we've been working on a bipartisan basis, how do we take the patient out of the middle? And if folks still want to go after each other, they can, but they go after each other directly, not through the patient. We think we've been successful. It's about lowering healthcare costs for the patient, particularly those who are trying to do the right thing.
There are a couple of approaches, as I understand it. One is to sort of set some rates, and the other is to have an arbitration. Where are you, and why are you in that place?
We're kind of in the middle, which is why we think we have the better bill. We say, okay, docs, you saw the patient, but you've been unable to agree with the insurance company. In the interim, to maintain your cash flow, the insurance company will pay you the median of in-network rates. Now, if you're happy with that, it's all over. But if you're not happy with that, on the back end, you can go to arbitration or payor. If you think you're paying too much, you can take the provider to arbitration. But we think most will be settled at that first median in-network rate. If there's exceptional circumstances, the arbiter can take advantage of that. One more thing, we base our approach on that which is being done in New York and Texas, deep blue and ruby red states, which have gone to a mechanism similar to ours, and it's worked for them.
So as you take pencil and put it on paper and you take a look at the overall healthcare costs in the country, if your approach were adopted tomorrow, what effect would it have on the cost curve?
Well, CBO says that we would save $17 billion. More importantly, for that family, we're going to save thousands, sometimes tens of thousands. But this is not where we stop. We've got to put market forces into healthcare. Nobody watching this channel, unless you're in healthcare, can believe the absence of market forces. There should be price transparency, where the patient knows the cost of something before she has the procedure done, as opposed to finds out 6 weeks later. There needs to be other things where gag clauses in which providers keep insurance companies from telling patients the cheapest place to go. We have to get rid of those gag clauses. All these are working against the patient, against the small business person, to make them pay more to the benefit of the providers. As a doctor, as a provider, I think we should be on the side of the patient. And that's kind of the purpose of this piece of legislation and several others I have.